Our topic is good health, which we should all be concerned about, and our guest on the program today is a lady by the name of Erin Dixon from the Washoe County Health Department. Erin, nice to have you here.
Thank you. It's my honor to be here.
Tell us your specific title, please.
I am the Chronic Disease Prevention Program Coordinator for the Washoe County Health District.
You can't possibly get that on one card. You were going to give me your business card, but that would not be. I'd have to go on the back to find out that.
Basically, I work to help people reduce tobacco use, increase their physical activity, and increase proper nutrition.
How long have you been doing this job?
I have been with the county now for 9 years.
And what got you interested? Was it just, well, here's a job, I'm going to take it? Or were you really interested in health?
I've been very involved in public health for about 15, 20 years now. There is something incredibly enjoyable about going to work and making a huge impact on the community around me.
I would assume that getting to the younger generation, the school children, is very important in this anti-smoking campaign. And are you involved in that?
Absolutely. Reaching out to youth is very important when it comes to tobacco education. We have a number of organizations here in Washoe County that do a great job. They have American Lung Association has a great connection with the school district, and we have limited resources at the health district, so we don't go out and do what other community members are already doing.
You really can't get into the classroom. You just don't have the personnel.
You don't have the personnel, and American Lung Association does such a great job. Why would we try to duplicate that? We'll put our efforts into working with businesses and helping them set up a tobacco policy. I don't know if you've noticed at City Hall here, there's a 25-foot minimum distance from the front door. We try to encourage policies like that.
I didn't realize that. So you go into the business and you establish some guidelines for their employees or their customers with regard to smoking, right?
If the business would like that, absolutely. Absolutely. Those are things that we promote and encourage. The CDC says they're best practice, so therefore that is something that we would absolutely assist with. So if there's any business out there that would like assistance, please give me a call. Do
you go out and solicit businesses, or do you kind of wait for them to come to you?
A little of both.
Yeah.
We promote. I don't know if you're aware, we had an Extra Mile Award that we give out every year on the anniversary of the Clean Indoor Air Act, or the smoking ban. This year, our winners were Art Town. They don't allow smoking in their outdoor performances. The Aces Ballpark. They don't allow smoking in their ballpark.
Having been to a couple of the Aces games, I don't think the ban on smoking is keeping fans away. They always seem to fill that ballpark pretty well, and I think that's a good thing. I don't think anybody's. Are there any groups really offended when you say you can't smoke here? Have you ever run into that where they call your department and say, "What is this all about?"
Yes, there are some people that are still very active against. It's my right, absolutely. Have you noticed at the Aces Ballpark they also have signage up that will let you know how far you walk if you walk around the entire ballpark area?
Really? Yeah, I have noticed that.
So it's kind of, if you want to take a break and get a little exercise, you can do that at the ballpark as well.
I know that we in past years have always rated toward the bottom when it comes to smoking. We are one of the worst states for smoking. Has that changed?
Yes. We are getting better. It's definitely thanks to our community, thanks in some part to the smoking ban. We're really making progress. Not as great as we could have. We've seen some increases specifically in Washoe County in the past year among adults, but we are making progress.
What defines chronic illness?
Chronic illness at the health department, we define it as those diseases that are impacted by tobacco, nutrition, and physical activity. And in Washoe County, those are 7 of the top 10 leading causes of death. That is heart disease, cancer, lung disease, stroke, diabetes. Those are 5 of them.
Is nutrition a problem within low-income families, children particularly? Is that a concern of the health department?
Actually, nutrition across the board, for not just children, not just low-income, but our entire community.
A lot of seniors too, I would imagine.
A lot of seniors. And I don't know if you know this, but in Nevada, I just read this stat, we spend the most money in fast food restaurants per individual.
I'm sure that's true.
So we do have a problem with getting proper nutrition. And there are a lot of diseases that come along if you lack proper nutrition. And it's not calories in, it's the nutritional value of those calories.
Aren't there programs to help, particularly with youngsters, their nutritional, like a free breakfast at school or something like that, or after school?
Yes, and I don't know if you've done any interviews with the school district or the food program. They have made incredible changes in the school lunch and breakfast programs. Wonderful changes that really help the nutrition for our children.
Are a lot of these programs funded by the government, the U.S. government?
I believe the food nutrition programs are.
What about your particular division? Do you get grants?
Yes.
Outside grants
Yes.
to keep things going?
We actually, in one of our most recent grants, is we got a grant called the Achieve Grant, and we went around to different businesses, different organizations, and looked at environmental policies that are impacting nutrition, physical activity, and tobacco. And we found that nutrition was the biggest risk factor, that they didn't have anything to address it. So as part of this process, we are trying to work on a food plan that will help local organizations, families, different associations kind of improve the nutrition.
When you say a food plan, what actually saying you need this many vegetables every day and this much fruit and this much calcium, that type of thing?
No, more of talking about access to healthy food.
Okay.
You know, I'm still looking at some of the research. I do know it's out there, but what's our grocery store allocation in different neighborhoods? Mm-hmm. You know, does our community have access to fruits and vegetables? Mm-hmm. You know, I personally know if I had to get on a bus with my 2 children, get on the bus, transfer to get to a grocery store, I'm not going to eat fruits and vegetables.
You're not going to do that. You're going to go to the nearest whatever and get a cheeseburger.
Yes,
yeah, right, or a hot dog or something.
Yeah, that's exactly right.
And that is a problem, huh? Mm-hmm. How do you overcome that?
We are still looking at some of those solutions. Some of the other communities have done different creative things. We are still in the process of identifying where we can make the biggest impact in Washoe County.
Do you work with the hospital, St. Mary's and Renowned?
Yes. Yes, like we said, we don't duplicate anything they do. They are very good at what they do, and so we don't provide treatment. Mm-hmm. And so what we do try to do is work on the prevention activities, what we can do to help our community be healthier, how we can make the healthy choice the easy choice for all our residents.
Now, there's something coming up, which you said that I believe you said you're not too familiar with it, but you know a little bit about it, and I have some info here because we were supposed to have another person on to talk about this, but they had a last-minute meeting. So what are we talking about now? Some kind of a meeting?
It's a community forum, I believe, hosted by Truckee Meadows tomorrow.
And this is March the 31st, 5 to 7 o'clock, and it's up at the public television station, right? KNPB.
Yes, it is, and it's open to Truckee Meadow community members and non-members alike.
And I see that they say here, informal networking reception, targeted indicators, briefing report, speakers panels, and the panel. Eric, you're on the panel.
I am on the panel. I did know I was on the panel.
You need to know when it is and what time it starts, because you have to be there.
I can tell you that much.
In place and everything. Aaron Dixon will be there talking about chronic disease. Catherine Loudon, Washoe County School District, safe and drug-free school substance abuse, violence, and SHARE. What is SHARE? Do you know what SHARE is?
I believe that is the sexual health education program.
And I see that an old friend of ours, Zanny Marsh, will be the moderator. Zanny's from the Reynolds School of Journalism. So this should be a very interesting kind of event. It's March the 31st, again, 5 to 7 at KNPB. It's open to the general public. And a lot of things concerning health in Washoe County, I assume, will be discussed at that particular meeting.
Absolutely. I believe the topic is risky behaviors impact on health and wellness. So it's a great topic. I encourage anyone to come out who's interested.
And what's the future of your department? You were talking about, like everybody, you've been scaled down, so you're doing a lot of different things now. What are some of the things you're involved with?
There's a lot of things that we're involved with. As part of the coalition, you know, we host the Chronic Disease Coalition. We do Bike to Work Week, and out of our office we do, the coalition has started a menu labeling to work with some of our local restaurants so they can offer calorie and nutritional information to their customers, which is very exciting. Gosh, the list just goes on and on and on.
Bike to Work Week has been very successful, hasn't it?
It's been incredibly successful, yeah.
So part of your job too is, I would assume, informing the public through news releases and interviews like this.
Yes.
And trying to bring attention to better health, better eating, bicycling to work, that type of thing.
Yes, I don't know if you've ever participated in Bike to Work Week. Past 2 years, we've had about 1,000 people register with us.
Really?
Yes.
No, I can honestly say that I have not, but I'm going to tell you something. If Bike to Work Week, Bike to Work Day may be coming up for me if gasoline prices don't stop and level off here. We may be trading cars for Schwinn bicycles or something.
I live farther outside of town, and I used to drive my daughter to daycare and then bike from daycare to the office. And last year I did do it. I think it was 18 miles one way to the office. I have to admit I did not bike home.
You did not bike home.
But it is any way that people can bike and just give up the car for one route is we encourage it. It's not as hard as people think it is.
Erin, thank you very much for being our guest, and let's remind you that you can see and hear Erin again along with Catherine Loudon from the Washoe County School District and Zanny Marsh as a moderator from the Reynolds School of Journalism, and this is the TMT, and what's that stand for?
Truckee Meadows Tomorrow.
Truckee Meadows Tomorrow, and it is their meeting. The public is invited March the 31st, 5 to 7 o'clock at KNPB Channel 5, that's public broadcasting, up there on South Virginia. And it says here that Erin is a good speaker, so it should be a good tie-in with what you're discussing. That's from our coordinating producer, Amber Martin. Erin, thank you very much.
Thank you for this opportunity.
And our thanks to you, and please join us next time for Bob Carroll and Friends.